Hi, we're Touch Consult, and we are physicians that are dedicated to building web and mobile software for physician teams. And we want to introduce you to our innovative web-based patient management tool that helps medical and surgical residents manage their patients and sign out to each other. The problem we're trying to solve is that most medical or surgical residents keep their patient list in a spreadsheet or a text file in an isolated computer or in unsecure shared files such as Google Docs. We think a better way is to keep the patient list on a shared secure website. This gives several immediate benefits. Information is accessible from any computer or mobile device. This means that the patient list, tasks, and team sign-out can be viewed or edited using any web browser, an iPhone, or other mobile internet device. Attendings can now follow their patient's progress or add information about their patients. They can even add tasks to be done on their patients without waiting for rounds or having to remember who's on floor duty that day. Since access to the site is regulated by the residency program, who is viewing patient information is always known. This means, for example, that visiting students and residents can be given temporary access. And best of all, residents do not have to do any additional work since they already keep a patient list. In fact, by automating sign-out, residents save time and reduce the risk of errors. Here's what it looks like. Once the resident or attending has logged in, they would see this screen. As you can see, each patient is a row. On the left is the patient name and some patient details such as allergies. Attendings can be organized into services. A brief history of the patient is in the next column. Clicking on a row would expand it and show full details about that patient. It is important to note that the columns can be customized to fit the needs of each team. I'll show you shortly how this is done. The medication column allows for a date entry for each item and then displays the days elapsed since that date. The notes column serves as the sign-out, where the team can include information that the resident covering that night or weekend should be aware of. Clicking on the Add Task button opens a pop-up where the patient care tasks can be entered. The phone book allows for frequently called numbers to be stored. And here is displayed the team, including each member's role, rotation end date, and their pager numbers. Information is entered into the patient's record using a single window. At the top, the patient's name, attending, and room number are entered. A brief history can be included, as well as any miscellaneous details. Since there are multiple teams in every residency program, a patient can be added to one or more team lists. In addition, a team can have one or more private lists, such as for patients seen in the emergency department or to be presented in conference. The problem list is entered as individual items with optional details. Medications are entered as individual items with optional dates. When events or tasks are added or completed, the resident who made that change is noted. This can be helpful in services with multiple covering residents, for example, in case the team has questions about an event that occurred overnight. Each team has an assigned team captain, usually the senior resident, who would have permissions to change the settings for that team. These would include which columns the team wants to be visible, and which of those should be printed for sign-out. This helps prevent information overload for the covering residents. Any additional team lists can be added or modified here, and attendings can be grouped into services. Over here, each resident can set their current home team and when they rotate off. And below, each resident indicates what other teams they cover. They would then have access to those teams lists, again, saving time at sign-out. How does this work? It's very simple. This is a subscription service. It's priced by the program size. Setup is done online, and the ease of use means that training time is kept to a minimum. We offer a 2 months free trial. There's no long-term contract. If at any time a residency program is not satisfied, they can simply cancel without penalty. We have the capability to securely integrate into your hospital's EHR, medical record system, and pull in census or medication data if granted permission by hospital IT. We encourage you, however, to first try the application. And if you agree that it saves residents time and helps reduce handoff errors, it'll then be easier to approach hospital IT. We hope this presentation has been of interest. If so, please do not hesitate to contact us via email or telephone. Thank you very much.